Hello everybody, thank you so much for joining our conversations on PAZA. PAZA, a Swahili word meaning to amplify, is an initiative by Disability Trust. PAZA seeks to document and create visibility for the experiences of women with disabilities globally. We look forward to hearing from you, so remember to share your support and feedback on our social media platforms. To continue this conversation, please follow our Twitter page at PAZA Podcast. For more content on Disabilities work and projects, please follow Disability on Twitter and Instagram at dis_ability_KE and on Facebook at disability.ke. Now, let's get into today's topic of discussion. Good afternoon, everybody. We are very pleased to be hosting the 4th episode of the PAZA podcast. And today's topic of conversation is sexual and gender-based violence during COVID-19, exploring the experiences of women and girls with disabilities. And on today's conversation, we have amazing speakers that represent communities of women with disabilities in the counties. And I will allow them to introduce themselves. Easter, do you mind going first?
Okay. My name is Easter Oketch. I'm the Executive Director of Kenya Female Advisory Organization, and we work in the Western Kenya region. That's about 14 counties in Western Kenya. It's my pleasure to be with you here today.
Thank you very much. Fridah?
My name is Fridah Wawira. I work with Coalition on Violence Against Women, the program officer and also the communication officer. I'm based in Narok, but our head offices are in Nairobi. We are in 6 counties in Kenya where we are implementing various projects.
Thank you very much. And my name is Lizzie Kiama, and I am the host for this podcast. I am also the managing trustee at Disability Trust, where we work to advance the rights and inclusion of women with disabilities in Kenya. So, ladies, shall we get into it? Easter, could you tell us how KEFEADO works, and specifically around issues on sexual and gender-based violence?
KEFEADO, which is Kenya Female Advisory Organization, has worked in this area of women and girls empowerment for a long time. And we use an intersectional and intergenerational approach, which means that we look across board who is at community level, who is a female, and how then they engage with different issues at community level. So one of the things that we have done is that in our different programs within the schools where we work and within the communities where we work and within the different institutions where we've worked with, we have realized that there's been a lot of issues of gender-based violence within communities and in the different forms. So the different forms of gender-based violence which you have noticed is FGM, within Mount Elgon where we've worked, and even in Kisii. And also then there's the high level of sexual and gender-based violence, which happens at community level. One of the things which we noticed during this COVID period is that it has increased. And the levels of violence which we are looking at is, apart from just the sexual violence which we are seeing being perpetrated, we are also seeing physical violence, we are also seeing economic violence, and we are also seeing the bit of the mental issues which are coming from those close issues. So mental violence, emotional violence is also being seen. So those are the issues which we are dealing with during this COVID period, on how to engage with different people, but particularly with women and girls with disability who, fortunately, are not reached out to even by the different gender-based violence groups, and thus are not being addressed holistically. Thank you.
Thank you, Easter. Fridah, could you tell us how the Coalition on Violence Against Women works, particularly the project you have with women and girls with disabilities? Could you speak on that, please?
Thank you so much. Coalition on Violence Against Women is a non-governmental women rights organization that exists to champion the rights of women and girls to be free from all forms of violence. We are currently implementing 2 projects that are targeting intellectually challenged women and girls. The project is titled Enhancing Access to Justice for Sexual and Gender-Based Violence Victims with Intellectual Disability. The project is being implemented in Kiambu, Nairobi, and Narok County, and it has been funded by African Women Development Fund. So what we do in this project is that we enhance public knowledge and awareness on the rights of persons with intellectual disability. Through this, I mean we conduct community dialogues or community conversations around the rights of persons with intellectual disability. The second thing that we do is we work hand in hand with the National Council to facilitate the registration of intellectually challenged women and girls in the farthest to reach community. That means that we conduct registration exercise hand in hand with the National Council of Persons with Disability in the farthest to reach areas, like in Narok County, whereby it's quite hard for persons with physical, mental disability to get to their offices. So we facilitate their movement. The third thing that we do is we provide court representation to survivors of sexual and gender-based violence with intellectual disability. So this means that we offer pro bono services. We have a database of pro bono lawyers that we work with, and in case there's a case that has been forwarded to us involving someone with intellectual, I mean mental disability, we are able to offer pro bono services. We give them psychosocial support, and also we give them transport to go to the court. Another thing that we have been doing in this project is that we do a lot of lobbying activity, especially with county health committee in the various counties that we're implementing, so that we can lobby for an inclusive legal and policy sexual gender-based violence framework, such as like in the last lobby meeting that we had in Narok. It was an advocacy meeting with the county health committee to lobby for exemption of medical assessment fees for intellectually challenged women and girls. Another thing that we are doing in this project is that we sit in the court users committee, where we discuss matters on enhancing access to justice for intellectually challenged women and girls. For instance, in 2019, through the court users committee, COVAW was able to push for an open day, for a CUC legal aid day or an open day. And also we were able to push for a judiciary service week where they prioritized 48 cases of survivors of sexual gender-based violence that had been pending for quite some time. So that is basically about our project on access to justice for girls and women with intellectual disability. Then we have another project that we are about to start next week. It's from Humanity Inclusion. It's a seed fund, and it's in response to COVID-19 pandemic. So what we'll be doing is that we'll be providing food package, sanitary towels, airtime, tissue, soap, mask to at least 100 families with girls and women with intellectual disability. The second thing that we'll be doing in that project is that we'll be having a back messaging to general public on educating them on safety measures during COVID-19 and issues to do with prevention of sexual gender-based violence. We are currently conducting a mapping exercise of 100 families with intellectually challenged women and girls from low-income areas, from low-income earning areas in Nairobi, that is Mukuru, Kwajenga, Dadora, Mweki, Kiandutu. So that is basically the 2 projects that we have that are targeting women and girls with disability.
Great, thank you, Fridah. I just had a follow-up question. The first project you were talking about, among other things, it also looks to create, generate knowledge and create awareness in the community. So I'm just curious, particularly in the counties that you work in, what has been the community perception of the groups of women, particularly the women and girls with intellectual disabilities? What was the existing community perception?
The first thing that I would say is that there is a lot of stigma discrimination around women and girls with disability, especially in Maasai Land, whereby women and girls with disability are viewed as a curse or a bad omen. And in that, it's quite sad to note that even in the most interior parts of Maasai Land in Narok, when a woman gives birth to a child with disability, they are stigmatized, and some parents end up throwing these children in the forest. And even they are not dressed, they are not fed. Another issue is the communication barrier. You find that girls and women with intellectual disability may not even know if they have been sexually abused, not even know how to report, and even lack of family care support. Whenever an incident is reported or occurred, you find that no one believes them, leading to the frequency in occurrence. Like, I was abused yesterday, next week I'm abused, but when I come and share with you that I was abused, no one believes these people with mental disability. The other thing is institutional failures. You find that even the police officers, we don't have trained police officers, or we don't have gender desk specifically dealing with persons with mental disability. So there's a lot of communication barrier, stigma, discrimination. When you go to the hospital in Narok County, most of the hospitals of health facilities, they don't have the sign language interpreter. So there's a communication barrier between a person with mental disability and the health professional. So you find that they are not able to access sexual reproductive health services.
Thank you. Easter. So I'm just going back to what KEFEADO does around sexual and gender-based violence. I just would like you maybe to go deeper on how, not necessarily how COVID has increased instances of SGBV, but what was the current situation even before COVID of women and girls with disabilities?
One of the things which we are looking at is the issue of the same thing which Fridah is saying, the lack of service and the lack of structures which are put in place to respond to issues of gender-based violence, even in the reporting structures. Because, for example, one of the things which we're looking at is that within the referral pathway, when anybody who has a disability would go and report, for example, because of the discrimination of women with disability, for example, if you went to report an incident of sexual violence, somebody perceives that maybe it was a favor because people are profiled differently. So one of the challenges of that profiling then ensures that the discrimination is then never reported because of access to information and access to those kind of spaces. So one of the things which we're also looking at is that within these particular spaces, when you go and report within the referral pathway, we do not have enough structures to respond. For example, if you go to the police station and if you are having hearing impairment, do we have a sign language interpreter? They're not often there, so you cannot report. So you have to get someone else who probably might be the perpetrator or will be at a cost to you who is the survivor. And one of the challenges which you're also facing is that, for example, if you go and report and you are visually impaired, when you're writing your statement, how do you write your statement? How do you ensure that your statement is well recorded? And part of it is that then when you're required to go with an aid, what if your aid is the perpetrator? And we have had incidences of the police not actually recording what you're saying as a survivor. So part of it, if you're not able to verify those statements, then it becomes a challenge. So when you need aids within those structures, then it becomes a challenge. And it becomes even worse because we have women and girls, we work with women and girls with disability from rural communities. And where these ones, the issues of even hiding them is supposedly very normal. So part of it is that even getting access to these structures where you can state what is happening is a challenge. And we have seen increased levels of violence, and in certain spaces where we are, particularly with women and girls with intellectual disabilities, we are seeing repeated sexual violence against those particular women. In one of the cases which we are trying to handle now is where a mother is a trader and has 2 girls with intellectual disability. Immediately she leaves to go for work, they are violated repeatedly. And they also have children who are also with intellectual disabilities, which means that she's very constrained. So part of those challenges which are faced within community levels is that unfortunately government is not really looking at the protection services for this cohort of persons, particularly women and girls with disability in the spaces wherever they are. So those challenges which we note is that we are trying to then push this agenda, and we are also part of that issue of the support by Humanity and Inclusion to look at how even to get shelters. And even when we get shelters, are the people within those shelters able to deal with the different disabilities which will go in there? So for example, the women and girls with intellectual disability need specialized care. Are they able to support that? Do we have personnel within those structures who are able to support those kind of women or girls? Or sometimes there are people with multiple disabilities who are able to support them within these particular spaces. Because apart from the households where we see and the areas where these things happen, we have also noticed, because we work in institutions where we have children with disability. And we also noticed that learning institutions are also spaces where there's a lot of sexual violence against women and girls with disability. So one of the things we are saying is that the structures which are in place do not holistically protect women and girls with disability from violations. And even in terms of seeking both social justice, because in terms of social justice, the people tend to think about our sexuality, so you'll not be believed so easily. So part of it is that the bit of where we are talking about the sexual rights of even women and girls with disability, people think that you deserve it or somebody did you a favor, which is a violation of the rights. So the social justice issues which come at community level, and then the legal justice processes. No, in terms of getting access to justice, even within the courts of law, it takes a lot of time. One of the challenges which we face is that some of the girls and women who come from very poor backgrounds, so the economic issues then are constraining them from attending court processes. And because you have to keep on traveling to that particular court processes and you come from a poor background, then you are also constrained within the spaces. So a whole myriad of things which then ensures that one, there's the social discrimination at community level, there are the economic issues which then predispose some of these women and girls to the challenges that they are facing. The issue of the social discrimination, and then the areas where then patriarchy then happens. Apart from that issue of that one is that we have also seen that apart from the sexual violence, early marriages are also done. Because in our spaces where there's the issue of wife inheritance, they will always look for a girl with disability to be the one who is inherited. So part of it is also the rights on issues of early marriage and the marital rape which is faced within those particular places. So there are many challenges which need to be addressed, and it is important for us to raise this issue when you're talking about gender-based violence, because one of the things which hurts me most is the invisibility of the data on the violence which is perpetrated against women and girls with disability. Within Kisumu County, we are looking at the data from the Gender-Based Violence Recovery Center, and there's silence. There's silence on it. You can't see that data. So it means that people are subsumed, so you cannot address the issues which are required even within those spaces, to have sign language interpreters, to have examination beds which are commensurate to the different disabilities, like the physical disability which is needed during examination. So part of it is that we also have to talk to ourselves as people who respond to issues of gender-based violence, that why do we think that data should make women and girls with disability invisible? They shouldn't be invisible. They should be visible so that their needs are addressed.
Thank you, Easter. And just to touch on what both of you have spoke about, you've talked about invisibility, Easter. You've talked about invisibility, which then spreads and shows itself in the lack of policy, the lack of implementation, and also in our programming. But also on the other side, Fridah, you've talked about knowledge creation, awareness creation. I'm just wondering, at what point do we begin to see a difference? Because we as NGOs, as nonprofit organizations, we invest quite a bit in awareness creation. And for me, and maybe this is a personal fight, maybe I should stop fighting this fight. I feel like everything is rooted in the unconscious bias we walk around on our perception of disability. Our experience with disability, the non-disabled people, and even disabled people themselves, there's this negative perception we hold very dearly, and that comes out as unconscious bias, which then magnifies the invisibility. It magnifies the lack of specific language in our policies, and also trickles down to our programming. So I'm just wondering, when we are working around awareness creation, what do you think that we need to do differently in order to bridge this gap of invisibility?
My take, I think we've done enough awareness creation. Part of what we are looking at is that beyond just the awareness, there are policy issues which we need to demand for. And it means that who is sitting in the room when the policy issues are being discussed. So in terms of, for example, we have various sexual and gender-based violence policy documents and who it's supposed to target. So part of it is that are the policy makers, are the duty bearers actually being put to task? So part of it is that in terms of what we are looking at is that we need to be able to start tasking duty bearers to actually listen. If you look at the history of what the women's movement has been able to do, is to be able to put enough pressure. So are we able to start developing a movement beat, a very pulsating movement, which then you are tasking duty bearers to actually then answer to the questions? One of the challenges which is faced is that sometimes women's with disability organizations and individuals are also invisible within the disability movement itself. So part of it is that the patriarchy within the disability movement means that women's issues are subsumed by other disability issues. So for example, in the response, people are saying they're not even talking about the sexual violence. People will talk about economic issues, which then target the other gender. So part of it is that how do we then rally women within the movement, in the disability movement, to be stronger, capacitate them to go beyond awareness and start sitting on those particular policy making spaces and demand. So how do we also capacitate? Because one of the opportunities we have, for example, we have a senator, a nominated senator who is sitting at a policy level, Danita Gatti. So how do we target such persons like Honorable Danita Gatti to push beyond just policy development to policy implementation? The challenges we face is that we have very nice disability policies, even within the county, with no implementation framework and with no financing framework. So you have this disability board within the county and maybe at national level with no money and no other resources to be able to move. So even within the counties, we need to target the disability boards and ensure that they implement the policy and ensure that the visibility of the issue of disability is actually budgeted for. Then we will ensure that we go beyond just creating awareness to implementing whatever frameworks which we really need to implement, and ensure that we have activities which are targeted to alleviate the challenges which are faced, particularly on the issue of gender-based violence against women and girls with disability.
Thank you very much. Fridah?
In regards to the question that you have asked, I think we need a very well coordinated GBV response team at county level, especially among the justice actors. Hereby, I mean, like at the police station, when a case is reported, let's have a gender desk. You know, not all police stations have gender desk. Let's have a gender desk. When the court is when the case is taken by the prosecutor, Let's have someone who understands persons with disability. In the courtroom, let's have the magistrate, and also let's have intermediaries in this court, whereby persons with special needs can express themselves, they can be understood, so that even it can enhance access to justice. Second thing, the GEC has a policy model, but in Kenya, very few counties, I think, I don't know how many counties, very few of them have county-specific sexual gender-based violence policy. So I think we need to borrow a lot from the GEC model on SGBV, so that we can tailor-make those policies. And then we lobby for gender-responsive budgeting. When counties are doing budgeting, let's ensure in our lobbying, they put in place resources, even though there are resources to put up shelters. They put resources to put up shelters so that women and girls, survivors of gender-based violence, they can be able to at least seek refuge when they are faced with violence. Thank you.
Thank you very much, Fridah. Thank you. So do you mind tying into what Easter was saying in terms of the need for a movement of women and girls with disabilities, and maybe touch on the experiences that women and girls with disabilities in the counties where you work in, and how feasible it would be to include them, or how strategic it would be to include them in a movement building process?
Yes, I would say that women and girls with disability, I agree with Esther, they need to be included in key decision-making areas, especially during this COVID-19 response. Let's see women with disability in key decision-making areas, so that they are able to talk on behalf of other women, because they are the only ones who understand the challenges that women and girls with disability are facing. But currently, we don't see representation of women with disability in these key decision making areas at county, even or at national level. So I totally agree with Esther.
Part of it is that one of the things we have to also state is that we are tired of tokenism. The bit of tokenism is that within the spaces in the room, when you're allowed in, usually it's a tokenistic affair, and it's supposedly a benevolent thing which government is doing. Part of it is that, for me, we must resist the tokenism and ensure that the resources which are going into those particular spaces, the shelters which you're talking about, the rescue centers which you're talking about, must be holistically funded, and we have to be able to see them actually working. For example, one of the things we are saying is that policies are developed, and it is assumed that everybody can read those policies. Yes, we can read, but sometimes what we're asking for, can the policy document be done in Braille, for example? How much will it cost a county government to ensure that that policy document is in Braille? We have a sexual and gender-based violence policy within Kisumu, which we are hoping to roll out to talk about these particular issues. But whilst we're looking at that, in public participation, for you to be able to participate in those processes of even allocating resources, how many spaces are actually conducive for women and girls with disability to participate? Then you can't put your voice in those particular spaces. And that means that always then even your voice is not in those particular policies. So I'm also calling us to action as a movement, as a women's movement, that how do we push an agenda so that those policy frameworks are actually responsive to the different disabilities that we have. For example, whenever we go for public participation and we're talking about documents and allocation of budgets, even for shelters, we never even have sign language interpreters sitting in those public spaces. So it means that even if I had an issue, if I'm a woman with hearing impairment, I will not be able to sit in that space and be able to be heard. So part of it is that how do we then ensure that we are creating spaces as a women's movement and demand for those things to be there consistently, that service delivery must be there consistently, and that they are not supposed to be tokenistic, that one day it is there, the next day when you're almost making a decision, then it is not there. So beyond the physical access, we also want the access to documents, which are then responsive to the different needs. And even with girls with disability within their own institutions, How do we then respond to that? So for me, we need to question the movement and ask the movement that who have they left behind, and how far behind are women and girls with disability in the women's rights movement?
I think my question would be, why is it so easy to forget that disability groups exist? You know, I think some things would not fly in other sectors. So for example, you would not have a health policy or an education policy unless this happens. I'm not privy to that information. But would you have an education policy without an implementation plan and a budget attached to it?
Of course we have. We have a document called, we have a gender mainstreaming policy. And one of the things we talked about is that gender mainstreaming policy must include issues of diversity and disability in it. And this has to be budgeted for. So part of what Kenya is good at is that we're very good at doing policy documents. Tick the box, the policy document is there. How will it be rolled out? How will it be implemented? No one ever thinks about that. So part of it is that the implementation framework of these policy documents is what we also need to track. For example, the Constitution was very clear. Certain things were supposed to be done within certain frameworks. So even in our policies that we are looking at, how is the policy framework supposed to be implemented? For example, if there's supposed to be 47 shelters, that is at county level, we can have 47 shelters at county level. And then at national level, that means they can have 48 shelters. We talk about shelters, but no implementation framework to say that by when are those things supposed to be done. So part of it is that then we become very comfortable with other issues and not considering that these issues are important. So we must then ensure that within our framework, we are very strategic and very calculated in targeting to see when it's being implemented, how much is being done, and then target at county level and at national level. At national level, there's the Intergovernmental Budget and Economic Council. We can push that agenda so that they speak about it because NGC is there, the Council of Governors sits there, Treasury also sits there. How do we push our agenda at national level? At county level, how do we target the county budget and economic forums and ensure that the persons with disability who sit within those forums understand the context, the gendered context of the needs of women and girls with disability? Then we'll move, and then we'll have budgets, and then we must track whether those budgets are actually given or they disappear. So it's a bit of work, but it's doable.
Do you have an empowerment program within KEFEADO? And if you do, could you talk about its importance in terms of fighting against SGBV?
Yes, we have an empowerment program within KEFEADO where we talk about the community empowerment program. And the work is done by ensuring that community level, community members are empowered to voice their issues. And we work with what we call the community-owned resource persons who are diversified and include the women and girls with disability. So when we talk about inclusion, we also talk about the issues of inclusion of sexual minority groups within this particular place, because we talk about they're the ones who are left out of the power structures. So the community development program looks at that, and we engage with community members at that level through that particular program. So we have those community-owned resource persons who then, once trained even on issues on paralegal training, are then able to take up these issues and take issues up to court. And within the schools and community linkages program, that's another program. That's how we work with people in schools and in institutions of higher learning. So within those places, we give the talks, we speak about the issues of rights, the constitutional framework, how to be able to get your rights, and then create the linkages. So the linkages with different arms of government, whether it is the Department of Health, whether we need to sit with the governor, we'll find out how to sit with the governor at one particular place so that we can get budgets, access to the assemblies, and those kind of things. So we have that community empowerment program, which even gives people knowledge on where to go. We tap into what they're doing and then refer that to that particular place. So our programming is based on the issue of community engagement and the fulcrum of community voices being part of it. So that is how we have managed to engage with our schools within who work with schools with disability within the county and also at national level, and using also different skills like using art. So we have used art to also engage with children. So for example, in Kisumu, we used wire art to engage with children with visual impairment at Kibo School for the Blind, so that then they're able to feel the messages, because we do art and use messages, so the children participate in those messages. And for example, in Bondo for the Nyamonye School for the children with disability, we used painting, so that they're able to then participate in those conversations in their own way. So part of it is that how do we use innovative measures so that then they can speak, but they can also learn at the same time on the challenges that people face. And one of the challenges which we are faced, which we also need to address, is that sometimes the issue of not thinking about the sexual maturation of also children with disability. Because of the discrimination they face, there is delayed development and in terms of even engagement in the school. So they are also adolescents, and some of them are adults within institutions of learning. And we never consider this. So part of it is that we also talk to the schools on how to engage them on sexual maturation so that they do not face unwarranted sexual advances and are able to protect themselves. So the language which we use is also something which we need to look at when engaging with the children in schools who face gender-based violence, and also children out of school who are discriminated against.
Thank you. Thank you. I'm just curious, just to follow up on the empowerment program. Have you had cases where the community supports or intervenes on behalf of a woman or a girl with a disability in instances where they're not considered a credible witness, violation, a sexual, violation that has happened?
Part of it is that in terms of there are various ways in which even you bring in a counselor, because a counselor can be able to see things which a normal person would not see. So how do you get counselors who are able to be able to gauge? For example, during this COVID period, a girl with intellectual disability was actually defiled in Kisumu. And the reaction to the person who was thought to be the one who was defiling, when that person walked into the room, the reaction, based on the reaction, because when everybody else was in the room, the girl was very calm. But when immediately this person came into the space, then the girl became agitated. So part of it is that also training counselors to be able to pick up certain issues. And even within all the different spaces, how do we get counselors to be able to work with the different disabilities? So that even with intellectual disabilities, how do we get them to be able to gauge what it is and use different methodologies? And that is why we are very insistent on how do we work with the gender-based violence recovery centers to be better equipped, to have the trained personnel who are able to work with the different persons who work in there. So how do we get them to be able to have counselors who can be able to work with women and girls with intellectual disabilities so that they're able to get to express themselves? So that training is required, but there are few trained people who are able to do that. And that's a gap which we need to also tap into, because then they'll be able to work. So that means it's a protocol within health facilities, for example, that it is a requirement. So part of what we are also doing is to push the service charter to be also inclusive, so that when the service charter in a health facility says that this is what they will do, we ask, there's that Washington short set of questions. Do you have issues to do with disability within your different departments? So those service charters, if they're queried, can then include some of these things within the health facility and within the different at community level, and then people will get to know how to engage.
Now, let's talk about this specific context of COVID-19. Could you touch on, and I'll start with you, Fridah, could you talk about what the experience of women and girls with disabilities in the counties that you work in, and what strategies COVAW is adopting to support them in this particular context?
as COVAW, we have seen an increase in the number of SGBV cases being reported to us, especially in the areas that we are working with. And some of the strategies that we are using is that we have rolled out a toll-free number whereby the community members can report in the cases of SGBV, and maybe I'll share that number towards the end of the podcast. The second thing is that for us, our work is continuing, even though the government has restricted people holding meetings for more than 15 people. For us, we are doing radio shows. Radio shows is what is working for us. Like today, we had a radio show in Narok County whereby we engaged Sidai FM and targeting communities in the marginalized areas. So the conversation must continue even if these meetings are not happening, and the way they must continue is through this radio show. The third thing we are using as an organization is the bulk messaging. We have a database of our beneficiaries. So every like once in a while we are sending information like a message to pass information of COVID-19 prevention measures and mitigation of GBV. And then because most of our beneficiaries come like in Kware, they were depending on the tourism industry, and the tourism industry have been closed now. At the Narok County, it's the same thing in areas of Sekenani, whereby they were still depending on the tourism industry. So we are offering our food packages, the one that I had said earlier, 400 families in Nairobi and other parts of Kenya where we are working in, targeting low-income areas, with back messaging. Thank you.
Thank you very much, Fridah. Easter?
Actually, similar. It's like we sat and agreed as women's rights organization. We're actually using similar things. We have ensured that we have the food packages, and we are taking them to the sub-county level also. And then we are also then utilizing radio to be able to speak about these issues, and ensuring that then in the terms of the radio, we are also including the women with disability to also be able to be visible in that conversation. And then part of it is that in terms of economic empowerment, because we're talking about COVID has messed up people economically. So you are within the spaces which COVID has done, it means that there's increased violence within the households. And it means that we need to also ensure that women with disability are able to recover for the ones in business. So we have actually put in a small package, which we will talk about, saying economic recovery package, because women who used to work in markets, who used to do their business, cannot do those businesses anymore. So we have said that in terms of this interim process, we'll put in an economic recovery package so that they're not disabled in terms of their financial capacities. And that one will ensure that within 3 months, based on the status of COVID, we'll still be able to ensure that they can start their recovery period and not face economic violence, which they're facing within their households. And we're also ensuring that they are visible, like we are going to be doing masks. And I think that is a program we're going to be doing with COVAW, with support of HI. And the masks which we want to do, the training on the development of masks, are also being done by women with disability so that they can have money during this particular process. So engagement on that then ensures that they are able to respond. But then we have also asked them, because there's what we call the humanitarian response, because Kisumu, Siaya, Homa Bay, we are grappling with both COVID and floods. So part of it, we have also asked that the humanitarian response must also have disability issues included. It wasn't included totally. And it is something which we need to look at. That in emergency response, does it mean that the people who with different disabilities do not have challenges, or are they left like when in Ahero, who takes care of them? So part of it is that we have asked even the people, the humanitarian response, to be very cognizant of issues to do with disability and ensure that when even meetings are being done, the first meetings now, no one with disability was present. People went on as normal. that it's okay that you'll talk for. So what we raised during that particular meeting was to ensure that they were included in the next meeting. But in the next meeting, as per usual, it was a male person who only talked about businesses. But we said that we are seeing issues at the household level. So part of it is that then we say that we also need women with disability organizations included, and now they have been included, but we are still not seeing the data which informs that how many of the households which are women-led have actually been targeted. We have not seen the response on the data which talks about the defilement cases and the rape cases which we have seen. The emerging challenges which you're seeing in the camps is that the camps are not segregated. So it means that in terms of the camps, the sexual violations are also increasing within those particular camps. So those are some of the things which are emerging, which we are dealing with, and we are hoping that we can get protocols, quick ones, to ensure there's something on segregation, to ensure that the reporting frameworks during this period, during curfew, is also addressed. So those are some of the things which then we are doing during this period.
Wonderful. Gosh, you guys are doing quite a lot. And we are working on collecting what do you call it, some support from private sector. And I think since you're already working on the ground, it might be interesting to figure out how to disperse this, because they're providing supplies but not the logistics part, and of course we cannot travel. But I wanted to explore whether you think there are any opportunities or any learnings that we could derive from this context as a nation, but also, from one another.
My learning is that things can be done differently. We never thought we would be doing Zoom. We are always used to traveling. It means that we can do a whole lot of different things and influence. Part of what I would like us also to do is that there are briefs which you can develop to government, both at county and national level, and also share those briefs on what needs to be done. So how do we do those briefs, particularly concerning the issues of SGBV and women with disability and girls with disability, and ensure that they reach the different places of influence, and ensure that, for example, the State Department of Gender then picks it up as an issue. So if those things can be done, there are things which we can actually do and put pressure at policy level, which we then can review. I've been part of processes where everybody keeps on looking at the Ebola and pandemic. And part of it is they're still saying that even in those particular pandemics, the issues of women and girls with disability were still very muted. So we have an opportunity to ensure that we can raise our voices, and it's a low-hanging fruit. So for me, that one is something we can start doing whilst we push for those food baskets at community level, sanitary towels, those kind of things.
Thank you, Easter. Fridah?
For me, yes, there's a lot of learning, especially on use of ICT. As a country, we should have a national GBV helpline that is very well resourced to operate 24 hours, that offers psychosocial support, ed care, as well as referral for survivors, in that it's online based and anyone from anywhere can call without incurring any cost. The second thing that we are learning is that we need alternative safe houses and shelters for survivors. As Esther was saying earlier, we have good policies, but we need the government to actualize that. And one thing that we really need them to actualize during COVID-19 is that we need alternative safe houses and shelters for survivors of GBV. And the last thing that I'm learning as individually is that self-care during COVID-19 is very important. Take care of your mental health, because we are getting a lot of news from here, there. So take care of your mental health, go for a walk, listen to a podcast like this one, check out how your beneficiaries are doing, regular listening ear. Yes, I think we have a lot of learning from COVID-19.
Thank you. I especially like the mental health one, and listening to a podcast like this one. It's a very useful learning. Now, in closing, and you've talked about some key messaging in the entire discussion, but specifically, what would be some key messages and strategies that we could recommend to the government around SGBV, specific to this current pandemic, but also post-COVID?
If I should go first, there's an advisory note that COVAW and other women rights organizations we drafted early last week, and actually it's available in our website. We were calling on the government to respond to GBV issues during COVID-19. And one thing I would say is that the government need to increase provision of financial support to vulnerable households to ease economic stress, especially to vulnerable female-headed households. Yes, I know they are doing quite a lot, but we need to see more in terms of financial support to these vulnerable households. The second thing is that the court should prioritize it to handle domestic violence cases as urgent cases. Because if we wait, remember in early April, the Chief Justice echoed that noted that there was an increase in GBV cases, amounting to around 35% of all cases that were being reported in court. So there is need for courts to handle domestic violence cases as urgent cases. Yes.
Thank you, Fridah. Easter, do you have any thoughts?
I think we're also part of that, the drafting, which was done by CREW. We were part of that drafting, and it had a lot of very key issues which then need to be rallied around. And one of the things which came out very clearly was the issues of the marginalization and the invisibility of issues to do with disability. So it would also be great if then we have also a face. We talk about nothing for us without us. Where is the face of women with disability in these particular spaces? And there were also certain things which were being drafted by feminist organizations across the world. The issues of disability also came in there. So I think that one of the things which you can do is that let us use online platforms to be able to, and more of this, to be able to ensure that those documents can be shared within the disability movement, so that we localize it in spaces where then the local persons can be able to speak about them, and then put to task the duty bearers to be able to act on their asks. So if we are able to do this within the next few weeks, then I think then we'll be able to then ensure that within each county and at national level, the asks then become similar and it becomes a pressure point. When there's enough pressure, then people can't ignore.
And I need to apologize. I should have checked in with you in the beginning. How are you both? How are you guys doing in this situation? Both of you, from a mental health standpoint.
We do self-care, part of it. And actually one of the things is that, for example, Urgent Action Fund is actually doing activities which then include different organizations to be able to just to dance or listen to music or to clap or do something. Mm-hmm. So that is something which is done. Like today, actually, after this, immediately after this, you choose music, do whatever you want, but at least within a collective, so that you are also able to share your experiences. So part of it is that even as a collective of women, what are we speaking about? How are we supporting one another? How do we check in on one another? So that then we don't go, it's a very challenging space at this particular moment because people are not used to it. So I think it's something which we need to tap into. And I think we can do things, even if it's a weekly thing, or if not weekly is too much, then every 2 weeks, something can be done. So Urgent Action Fund is doing something great. So you listen to music and just chill with your people, do a chill spot, and you can detox kiasi.
That's nice. That's nice.
Yeah.
Fridah?
For me, self-care is very important. Don't be confined in the house. And I mean, don't go out. Don't go out, but it's good to take a nature walk within your area, your home area. Yes, and listen to good things.
I just want to thank you both for joining us. If there are any last thoughts, any parting words that you would like to share, now would be the time before we close. I'll start with you.
It's critical, and we will survive COVID-19, all of us. Together, we can. Take care of yourselves.
Thank you. Fridah?
Allow me to share our toll-free number just in case you...
Yes, of course, yes.
So we have a toll-free number that we recently launched. It's operating 24/7. The toll-free number is 08007205553. Let me repeat, 0800720553. Thank you for having us.
We've come to the end of our session for today, and we're so grateful for your participation. Let's remember to continue the conversation on our social media platforms. If you would like to join the conversation as a guest speaker or discussant, please get in touch by sending an email to PAZA@this-ability.org. Remember to like and share our content on Twitter @PAZA Podcast. For more content on Disabilities work and projects, please follow Disabilities on Twitter and Instagram @this_ability_KE and on Facebook @disability.ke.